Hi everyone, in today's video we are going to explore the differential diagnosis of Haematuria syndromes. It's a topic that's high yield both in exams and in your clinical practice or in clinical pediatrics. We'll go through key conditions you need to know along with simple clinical clues that help you remember them. So let's begin with Goodpasture Syndrome, also known as GPS. Not GPS, but GPS. This condition presents with hemoptysis and hematuria. So think lungs and kidneys. It affects only these two organs. You will usually find abnormal urea and creatinine level. The hallmark is the presence of anti-glomerular basement membrane antibodies. That's your diagnostic clue. Next, we have Alport Syndrome. It's an X-linked genetic disorder. Clinically, it mimics Goodpasture Syndrome in that there is hematuria, but it also involves hearing and vision. So there is a hearing impairment and there is vision impairment. So remember the triad. That is Goodpasture Syndrome plus cannot see and cannot hear. Sensorineural hearing loss and ocular abnormalities are the key features of Alport Syndrome. Now, let's talk about alpha-1 antitrypsin deficiency. Now, that's a little different. It presents with hemoptysis and jaundice. So you have lungs and liver involved. If you see unexplained liver dysfunction with lung signs and hematuria, think about alpha-1 deficiency syndrome. Moving on to Churg-Strauss syndrome, which is now called eosinophilic granulomatosis with polyangiitis. The clinical picture usually includes asthma, eosinophilia, and multi-organ involvement, especially kidney. So if somebody has got asthma, viral wheeze, and they have got kidney involvement, you think about Goodpasture, you think about Churg-Strauss syndrome, and it's usually associated with P-ANCA positivity. So P-ANCA is positive. Next is your Wegener Granulomatosis or granulomatosis with polyangiitis. This one strikes the upper respiratory tract. So think chronic sinusitis, nasal septal perforation, and epistaxis along with hematuria. And the classic lab finding is C-ANCA positivity. So here the C-ANCA is positive, while in Churg-Strauss P-ANCA is positive. Then we have Hemolytic uremic syndrome or HUS. It usually begins with a diarrheal illness, often due to E. coli 0157 strain. The diarrhea turns bloody and then the child develops acute kidney injury and hematuria. So the classic pattern is diarrhea, then bloody diarrhea, then hematuria with renal dysfunction. Let's also talk about post-streptococcal glomerulonephritis. This typically occurs 1 to 2 weeks after a streptococcal throat or streptococcal skin infection. Children usually present with cola-colored urine, facial puffiness, hypertension, and low complement levels. It's an immune complex mediated glomerulonephritis. In contrast, IgA nephropathy, which is also called Berger's disease, presents with hematuria that occurs within just a day or two after an respiratory infection. Complement levels here are usually normal and it's caused by IgA deposition in the glomeruli. Now coming to some of the more common causes, urinary tract infection is a major one. It often presents with hematuria, fever, dysuria, increased frequency, and sometimes abdominal or flank pain. In infants, however, it may present only as unexplained fever, while in older children, burning micturition is more typical. A urine culture confirms the diagnosis. And finally, urinary calculi or kidney stones. They present with sudden onset of abdominal or flank pain, restlessness, and hematuria. They may have a family history of stones or metabolic abnormalities like hypercalciuria. Ultrasound is often the first investigation to confirm the diagnosis. So there you have it, the key differential diagnosis of hematuria in children. Some rare and some common, but each with its own unique clues. Learning these clinical patterns would not only help you crack exams, but also sharpen your diagnostic skills in the real world settings. So if you found this video helpful, don't forget to like, subscribe, and share it with your colleagues. Thank you for watching, and I will see you in the next one. Bye-bye.